Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you for tuning into the podcast. Glad you're here. Today, I want to jump into the same arc of episodes we've been working on with just the Make America Healthy Again and versus the Make America Medical Again. This is an important topic to discuss. This is so important because it's something I deal with every day in practice. And I know I'm repeating some of these themes again and again, but I believe repetition sometimes is necessary because by repeating something, it's like you lay a foundation of understanding. I'm a man. I'm a man. I will never understand what women go through personally. Never. I'll never experience these things you've experienced. I've never experienced the dismissal that you've experienced. I'll never be invalidated the way you're invalidated. I will never be vulnerable the way you've been vulnerable. I will never be afraid the way you're afraid when you go into the doctor's office. I will never be handled the same way you're handled. I know that. And that will never be something I assume to understand or know. With that said, what I do know is what I've learned and what I've heard and what I've seen. This is a labor of love from me to you. That's it. It's important to me to do this because, when I sit in a room with a patient and I look over their history and I've read their chart and I see what they've gone through, and it's there, it's very obvious. And I recognize this pattern of treatment they have, and I would not be the man I am today if I didn't do everything in my power to speak up and speak out against the system that we have on hand. Conventional medicine has caused profound harm to women. This cannot be argued. This cannot be argued in any way, shape, or form. There's so much research and evidence supporting everything I say, to the point where today's presentation, I will have all the citations added to it. I spent a lot of time researching for this too. It's not just anecdotal. It's not just my own experience in the room, because I know that my own single experience with all the patients I've seen over the 20 years in practice of medicine, that's still just me, one guy. So I make sure that I spend a lot of time following up and reading and studying and preparing for these things, because it's important that when I come here, I don't just spout just small perspective, that I'm being as broad as I can be and as helpful as I can be. To the degree that I am, like the episode, to the degree you like what I do, subscribe. And if you know someone that would benefit from what I'm about to share, share it with them. Share it with them. MAHA, Make America Healthy Again. How is it grown so quickly, and what is it, and why is it that I have some deep concerns with it? And then, why is it that I believe that conventional medicine has caused MAHA? This is my goal with this series. And today I'm going to go into, how the conventional medical system has created such a significant vacuum that MAHA can do nothing but succeed. It's just, it can't not succeed, given the profound failings of conventional medicine in the way that they've treated women. See, the thing is, with modern medicine, we've gotten so brilliant at saving lives, and we've gotten so brilliant at stabilizing patients. And while that has occurred, we've also become very good at compartmentalizing and monetizing medical care. We have put everything down to the minute, the second, the penny, the dollar. It has been so monetized that it is very hard for care to be present. The thing is, when care stops at stabilization, the patient is not well still. You know, normal labs don't equal a healthy individual because it's all in how you interpreted the labs. It's all in the labs you ran. But it's even more than that. It's the woman in front of you. And if all we're doing is trying to stabilize the individual and we stop care after that, that creates a void for these patients who are still not well. You know, an interesting statistic is that the average medical visit in the US is 18 minutes long, 18 minutes long. And in that 18-minute long visit, 72% of those visits end in a prescription. So 18-minute visits, 72% of them prescriptions. Less than 25% of them have any discussion in lifestyle, including diet, anything. Do the math on that for a minute. 18 minutes to tell someone a lifestyle change is nowhere near enough. Nowhere near enough to get an adequate history and sit down with them and spend time with them and understand the individual, tease out the data that you need from them. It takes more than 18 minutes, but that's what they have. And it's in these short visits and these quick fixes, that we lose what the practice of medicine truly is. See, the thing about women is that, when it comes to the endocrine system and hormones, my little arena that I practice within, it's complex, always. There's more than one thing afoot, and things interact with one another. You can't just give them estrogen without looking at the progesterone. You can't give them oral estradiol without running the estrone. You can't give them testosterone without labbing dihydrotestosterone. You can't just raw dog hand them off medicine without providing true care, or at least without consequence. Women require and deserve in-depth care, time spent. You deserve it. And honestly, I do it. And it's so rewarding, by the way. It sounds like I'm being very negative. I'm not going to be negative. I'm going to be very positive. I'm going to tell you right now, there's nothing, I love my job. My job is probably one of the best jobs there is. You have people come in with anxiety and depression and insomnia, and you run a lab and you see what that comes from. Or people come in with depression, and it may not be hormonal, but I run that lab and I figure it out, because what else could it be? I run the lab and it could be serotonin deficit. And what does that possibly do to? I can go down different roads of understanding. Is it a nutritional issue? Because that does cause depression in the literature, in reality, in texts. Just because the doctors don't use that or look at it doesn't mean it's not true or valid. When my daughter was little, we would play hide and seek. And she would cover her eyes when she was hiding. And she would cover her eyes when hiding. And I would find her. I said, I found you. And she says, no, you didn't. You don't see me because your eyes covered. This is how, she's very young when she did this. But it's like a doctor does that when they go in the room. When you go in the room with the doctor says, there's nothing wrong with you, it's because their eyes are closed. In 17 minutes, how can they open up their eyes to seeing all of you? They can't. That's not going to happen. That's not going to happen. It just won't. So when women present with complex hormonal complaints, they don't have the time to delve into it. They just categorize it as like, oh, this is psychiatric. That's all in your head. 3 to 8% of the population of women have PMDD. That's not a small amount. 75% of women have PMS. 75%. 1 in 8 couples experience infertility. Don't even get me started about libido. Libido is all these things are dismissed based upon psychiatric, and just go figure it out on your own. These are all medical concerns, legal, legitimate, honest, real. And I love it. I don't love you having it, but I love being in this space. I wouldn't be doing this long if what I did didn't work. And I didn't invent it. I'm not that smart. I didn't invent what I do. This is just basic stuff, basic endocrinology I'm doing here. Run a lab, you see a deficit, find out why you had the deficit, try and solve for the deficit. Like, some people have prolactin elevations, cause them not to elevate. So why do they have high prolactin? There's a couple different things. You find that out, you solve that, see if they start ovulating. Now they're making progesterone. We solved it. And then it could be also perimenopausal, where there's going to be deficits in progesterone. So you're not going to make it anymore. So let me start giving you supplement. This is all basic medicine. Nothing in here is fancy. I didn't invent it. Easy. And it's rewarding. So I want you to know it's not hard what I'm talking about today. Not hard at all. It's just not profitable in the current conventional medical system. And because it's not profitable, they don't do it. That's like my daughter. I'm closing my eyes and I don't see it now. I don't see it. It's not there. And you are there. You're there. You're there. You know who knows you're there? Maha. This is the hard part to talk about now. The psychological injury of invalidation is what drives people online to find a solution, because it is so depressing and lonely to feel dismissed, invalidated. And the things we talk about in here, when hormones are out of balance, that further throws off your sense of emotional equilibrium. And you are so vulnerable in that place. So online forums turn into, emotional triages, if you will. I remember that in the beginning of, online platforms like Facebook, you had these groups, people would join groups and just start going over what they went through. And I used to get a lot of patience. I still do. I still got a lot of patience from these groups online, from Facebook. People like, who's a good person to do this? And they send them here. And that's wonderful. And I feel very thankful for these groups because they are helpful. But the thing about these groups and this population of women, this is an opportunity for business. Think about it. You have someone who comes in to an office and they're not being well cared for. They're dismissed. They're vulnerable. They're suffering, and they go online and they're trying to find help and connection with others. So this is a whole population of people in this one group here that, when they're desperate, you can start selling them stuff. See, the thing is, though, that when people come into that space, influencers and podcasters and online celebrity docs, they often don't tell you, they don't disclose to you, more often than not, that they have financial interests in the things they recommend. They don't tell you that the things they're telling, that they don't inform you that they are going to profit off of their advice, and that their advice is not as wholesome as it comes across, because what they're doing is they're validating you for their own profit. And there's no making peace with that. Let me tell you that straight away right now. There's no making peace with a profit-oriented individual who's out to give you advice so that they can make money. There's nothing wrong with making a living. There's nothing wrong with it. We have to. The thing is what's the driver of the influencer? What's the driver of the individual that's speaking to you? And when they have undisclosed links to the supplements that they're selling, when they're profiteering off of that, to me, that's always questionable, because this has become a sales pitch, not truly medical care. This is actually marketing at that point. So many of the influencers that you see out there are not dedicated to your health. They're dedicated to marketing. Now, that business may be a wonderfully ethical, beautiful business that their goal is to get people well. That's true. But more often than not, it's not the case. It's not the case. It's more about selling a product. This is a sticky place I'm navigating right now. I know it is. And I know this is not perfect how I'm wording this. I'm aware of this. I'm trying. And I promise you I'll always try. A thing that not many people are aware of, we talk about a lot in the practice. 40% of supplements that have been out on the market, and this is a new statistic, I just saw this yesterday, 40% of analyzed hormone support supplements contain undeclared or incorrect ingredients. Undeclared or, inaccurate, and who knows what's in there. When I prescribe someone a supplement, say someone comes in my office and, just some like vitamin D, throw vitamin D out there. When I give someone vitamin D, I run the lab a month later to verify. There are times when I give someone vitamin D, I prescribe it and they go buy it at a rando store, and I get the labs back a month later and there's no change. And they promise me they're taking the vitamin D. This happens because there are times when people take vitamins and there's no benefit to it because there's not enough active ingredient in it to move the needle forward. The research shows me I need X amount of milligrams, or in this case, units, to move the patient in a certain direction. I need to prescribe that. And so I prescribe that. And I hope that it's going to work. But when they use a supplement that they find randomly online or in local shop, there's no guarantee that's the potency that we're looking for. And so then I'm stuck with trying to explain why this lab didn't move. And that's because supplements are not always what they tell you they are. There's no real good oversight in that area. I'm not knocking supplements because I do prescribe them. There are times you need to do that. There are times you need to prescribe compounds like that. Not prescriptive, but natural compounds. They work. There are good benefits to it. But I need to be accountable to my patient to prove it worked. It's hard for me to be accountable to my patient when the product is compromised. And then you as a patient are being told, hey, look, vitamin C is great. You should take vitamin C this. And you take the vitamin C and you think you're getting 1,000 milligrams, and it's 500 milligrams. So it's not really going to do the same benefit. I was thinking a lot about this episode. And in about a century ago, more than a century ago, 125 years ago. I wasn't born then, by the way. This is not me recalling something from my childhood. 125 years ago. 125 years ago, in 1906, so 120 years ago almost, the FDA, the Pure Food and Drug Act, created the FDA. The reason why is, women were being given, female tonics, basically opium. And if you look back in history, I guess this is my point here. If you look back in history, women, this has happened to you before. This happened many times, but let's bring up the one in 1906 when they came up with the FDA because of this. This is because people are out there just selling women opium. Just selling them opium straight up in a bottle, and cocaine straight up in a bottle. Go ahead, have it. There was no oversight. There's no care. And they were just giving it to women for hysteria. They've been and that's analogous to the detox supplements, the parasite cleanses of today. Sure, there's no cocaine in it or opium in there, so we've moved a little further as a species. But man, it's still, a lot of it's not the most ethical or honest exchanges with these influencers. This is the problem I have with Maha. And again, why did this come about? Why do women now turn to online and buying these detoxes for PMS symptoms? Why are women going down these roads and doing parasite cleanses when they have, gastritis? It's because they're being abandoned wholesale by conventional medicine. They're being dismissed and not cared for. I want to leave you with some positive stuff because sometimes I watch my episodes. I'm like, and I even at the end of it, like I was like, I talked to Evelyn. She's right, and Evelyn's right behind the camera right now. But I tell Evelyn, I was like, I feel like I sounded depressed today. I sounded sad, or I sound angry, and I reflect on that a lot. And I don't want to only leave you guys with sad things. I want to be good with you too. I want to say positive things. So just let me say this part. We know there's a good study out there that I just read on this that every 3-minute increase in consultation length equals better understanding and compliance on the part of the patient. Adding the information in, spending the time with the person is proven in the literature to benefit the case. Who would argue about time spent in the room? Who would argue about that? The people about the money people. They're the only ones that'll argue me on this one because they need to make profitability work for them. But they don't belong in this conversation. They don't. They've proven themselves unworthy to be in this conversation with us. They're not welcome here anymore. This should be a conversation we're having, you and I, and then hopefully it's someday with conventional medicine. Because as I've said in several episodes in this series, I want to say it again and be really clear with you on this. We have to reconcile medicine with women. We cannot continue this being separate. We must resolve this. We can't just move forward without using Western medicine. That is not a safe, stable, or sustainable path. And there are so many good people in the Western conventional medical system that want to do good. It's just their hands are tied, their times are set, and they're burning out. They're hating their careers. And that's a fact. But it's important that we do our best to keep an open door and we keep an open line of communication and we do our best to reconcile. So I hope this episode helps. I truly do. Thank you so much for tuning in, and I'll see you at the next episode.